I got a little bit of lean on. Right?
Ready? Well, good morning, everyone. Glad to be out here on this sunny day. Before I get started, I just want to give a round of applause of the men and the women on the Detroit Fire Department for their dedication and passion to serve the citizens of Detroit. My name is Chuck Sims, and I'm the Executive Fire Commissioner for the City of Detroit Fire Department. Mayor Mike Duggan, Deputy Mayor Bettison, the Detroit Fire Department, the Detroit Health Department, and Face Addiction Now welcome you as we unveil the details and the launch of the Detroit Opioid Quick Response Team. This new and innovative program will connect opioid overdose survivors to treatment and essential resources to improve future health outcomes. Detroit Fire Department personnel administered Narcan over 2,400 times in 2023 and was able to save many, many lives. But typically, that's where our services end. It's extremely exciting to know that those surviving patients would now receive a continuation of services that may prevent future overdose incidents and put them on the path of full recovery. The Detroit Fire Department's role in this program is to ensure that after the overdose survivor is stabilized, they are made aware of the services available to them and to immediately complete a patient care report. Once the report is electronically submitted, an auto-generated referral will activate the quick response team. These steps taken by the fire department will not delay medic units from responding to other medical emergencies. This new program, along with historic low response times, a 70% increase in daily ambulances, and just recently achieving the designation of a heart-safe city, are testaments to the department's commitment to the health, safety, and well-being of every person who lives, works, and visits Detroit. This innovative program is a little personal to me. My older brother, who's deceased now, was on drugs at one time, and that led to the onset of his mental illness. And he had family support. However, if he had resources that FAN will be offering, he probably would have had a better path in life, and it would have caused less devastation to me and my family. Because of my story, along with other similar stories, the Detroit Fire Department is in full support of this program. At this time, I would like to introduce Deputy Mayor Todd Bettison.
Good morning, and thank you, Commissioner Sims, and thank the men and women of the Detroit Fire Department. I have to mention EMS as well. It's a lot of thank yous to go around. Tricia Stein of our Office of Sustainability, Denise Ferrazzo of the Detroit Health Department, Andy Taverna, and on behalf of Mayor Duggan and myself, I want to thank FAN as well, Face Addiction Now. I know that this partnership here will really save lives. Oftentimes when an individual experiences an overdose, it's not fatal. In the ER, in the emergency medicine room, in the medical room, what you will see many times is familiar faces, overdoses, another overdose, and it's the same individual. And we know that Narcan has been a lifesaver and allowed individuals to overdose repeatedly, where we've trained the community where they're able to administer that aid. But the goal with this and this partnership, what's going to make it a lot different is the wraparound services to get them the aftercare treatment, to get them the intervention that will ultimately break the bond and free them from the addiction. That's what's the game changer. And so for everyone involved with creating this intentional program that's really intentional as to how we'll utilize the funding that's outside the box, that's going to ensure that the many victims, the many folks that are addicted to opioids, and we know that this is a national crisis. It's in every community. It has nothing to do with race. It affects everyone. It's an equal opportunity destroyer of lives. This right here today is going to help the most vulnerable, and it's going to help the children because it has a cascading negative effect on families, on loved ones, and it affects each and every one of us, whether it's directly or indirectly. So in closing, I can't give enough thank yous, but to the media and to everyone out there that's watching on social media today, just know that this will save lives. And if you don't know, we often talk about the number of homicides and the number of individuals shot and killed and all type of other stuff, but it's far more people, Americans, our neighbors, that are dying of opioid overdoses than you can even imagine. It makes the homicide numbers look small. Thank you all so much. And at this point, I'm going to bring up our Chief Health Officer, Denise Ferrazzo.
Thank you. Thank you, Deputy Mayor. It's really a privilege to be here. I'm here to really talk about prevention and the work the health department is doing. But first, let me just say that we welcome this QRT initiative because it ensures that someone who overdoses doesn't just go to the emergency center. They actually get the treatment they need. They get the referrals to the wraparound services, and that's what we need for our community. So the health department, we focus on prevention to promote mental wellness and also to reduce the stigma associated with substance use disorders. We provide outreach, training, and we provide referrals to wraparound services. And we do this in a variety of different ways. We provide substance use disorder prevention and education, peer recovery support, Narcan education and distribution, behavioral health training, and we also provide case management and referral services. So we are increasing access to Narcan, and that is a life-saving tool that we provide to Detroiters. Over the last year, the behavioral health team distributed over 8,000 Narcan kits. We also train Detroiters in how to administer it in high-risk areas like gas stations, motels and hotels, convenience, and liquor stores. And let me just kind of break that down. Every month, we get a report from the University of Michigan surveillance system, and we can tell who is overdosing in our community. We can look in all the many zip codes, and we know that the top zip codes right now for drug doses are 48228, 48205, and 48219. Those are the highest zip codes. And let me tell you, those zip codes are not going to be forgotten. And so my team goes out to those gas stations, they go out to the liquor stores, they go to the trap houses, and they are delivering life-saving Narcan. And our work is not going to stop because they need us. We also provided 115 behavioral health trainings. This includes adverse childhood experience training, trauma-informed training, and active listening, and also stress management sessions. We provide training to Detroit Police NPOs, treatment centers, provider network, and also we're at shelters for people who are experiencing homelessness. So the quick response team dovetails with the health department's mission of protecting the health of all Detroiters. We certainly welcome it, and we look forward to the Detroit Fire Department staff and working with them on this initiative so we can work together and save lives. And so with that, I'm going to turn it over to our medical director, Dr. Robert Dunn.
Thank you. I'm an emergency physician, and I've been involved in emergency medical services in Detroit since the 1990s. I think we all know that deaths from substance use disorder and opioids in particular are not something new. They're something that we've experienced in our community for as long as we've been looking at data, and we have had the tools to respond to it for a long time. The Detroit Fire Department was one of the first fire departments that provided naloxone to all of their first responders when that became available. We did training across the community, and we've used our data to work with community groups that really brings us to where we are today. Today is not an end. Today is just another step in the path. And that path is towards better health for the community resiliency, and improved outcomes for all of the people we take care of, the citizens of Detroit and those that are visitors. When we look at our data, we find, as Deputy Mayor Bettison was saying, we find a lot of tragedy. We find patients that it was too late once 911 was called. And many times we look at those patients and they've been users of emergency services, users of behavioral health services, and frequent users of emergency care. And getting more resources to people actually where we find them, out in the community, out in their homes, out in all the areas, is the key to helping people. I mean, we talk about wraparound services, but they have to wrap around to people actually out in the community. We can't just put something up and expect people to come to them, and we know that, right? Our first responders are the true healthcare safety net in our community, and we see so many people that we can help. And it's not just the person that called 911, it's people in the family. It is people that are friends and associates of those folks. And the fire departments led the way. We worked with the health department and Wayne State University on doing community training. Our community trainers have been out there teaching people how to use naloxone, teaching people CPR, teaching people about recognizing overdose so they call 911 when needed. And we are so excited to be working with Face Addiction Now. FAN has a long history across the metro area, and you can see by the number of people we just have here today. And it's my pleasure to introduce Linda Davis. Judge Davis originally started in the 41st District Court in 2000 and became an advocate for substance use disorder and recognizing that punishing people for a disease is not successful. She went on to found Families Against Narcotics, now Face Addiction Now, and has been a tireless advocate. I point people to her talks and the work that she does all the time, and particularly highlight the Hope Not Handcuffs program. So without further ado, Linda Davis.
It is such a pleasure to be here, and I first want to thank the City of Detroit and the Fire Department for giving us this opportunity. I do a lot of work around opiate settlement dollars, and I'm going to tell you that you should be the model of how this money gets spent. They have been tireless in really looking at programs that think outside the box and not just funding the same old things over and over again. And their unique approach to this has been inspiring to me. It's kind of lit a new fire under FAN. We see this as an incredible opportunity to model this to other communities for what can be done to save lives and improve the health of individuals within a community. So it is with great pleasure that we get to work with all of you. I also want to compliment the fire department. They have already made 100 referrals to our program, and we haven't even started the program yet. My team yesterday, when we were prepping for this, told me they have never seen a fire department is on this as this fire department is. So we see great things happening in this partnership with each other. Our program is unique in that we do think outside the box. We hear a lot about how minorities and how there's so many disparities in our healthcare system around substance use disorder. And I think Dr. Dunn hit it on the head, is when we're expecting people to walk into a brick and mortar building and ask for help, and they're suffering from a brain disease, that's really not going to happen. And the only way we reach those minorities is by reaching out to them and taking our programs into the street and meeting them where they are. So we have an array of programs and we intertwine all of them together. But the quick response team is basically the program that we're going to be doing with the fire department in the city of Detroit. But that will give you access, if you are suffering from substance use disorder, to family services. It will give you access to wraparound services that deal with your whole being, whether you are unhoused, whether you have food insecurities. We try to work with all of those issues that may be a block to you attaining long-term recovery, and then we stay with you throughout the course. We need to stop the revolving door to treatment. In and out treatment is not working, and it's because we don't treat addiction as though it's a disease. We treat it as it's a moral failing. And so we send people to in-treatment programs, we bring them out, and then we leave them to their own device. It's the only disease in our country that we do one-and-done programming, and we need to do better as a community. I believe that this program is a start of that kind of wraparound services, a continuum of care that treats every aspect of a person until they can walk alone and they don't need us by their side any longer. It is with great respect and admiration that we enter this partnership with the City of Detroit and the Detroit Fire Department, and we hope that this will grow into something that will save lives and improve the health of all of the citizens of Detroit. Thank you. I forgot my next job. I'm going to introduce Thomas. I did want to indicate that one of the reasons we're successful is that 98% of all of our employees have lived experience. They're either family members like me. I had a daughter that 17 years ago suffered from an addiction, and that's what inspired me to do this work to begin with and to learn more. And she is doing well. She's a survivor, but that's not the story for a lot of people. But Thomas and Tanisha, who are going to be talking next, are people that are in long-term recovery. We meet you where we're at, and we understand what you're going through, and that is the uniqueness of what we do. Thomas?
Wow. What an exciting day. First, let me say I want to thank the City of Detroit for giving Fan the opportunity to be able to do this. And I say that because it's something that I've been looking for the city that I grew up in for a long time. And I'm just grateful that I work for a company who sees a need and goes after it. But I'm also very, very grateful that the City of Detroit has teamed up with us to help us deal with this issue. I wanted to say that gratitude because it really means a lot to me, because I am a person in long-term recovery. I was addicted to drugs and alcohol for most of my adult life. I started using drugs when I was 24 years old. Some of y'all remember the Cass Corridor. I was homeless down there for 10 years. I slept up under the bridge on the 75. So I know the pain and despair that comes with addiction. And I also know with the right people in your corner and the compassion and removing stigma, how it can help somebody transform their lives. Today I have a life that's worth living, right? Today I have a life that I'm able to sit here at a press conference, a person who slept up under the bridge on 75, and talk about being the project manager of a team of people who's diligently going to go out and pursue to help other people like us, right? People that suffer from SUDUs. That's hope. That's hope, and that's what we need to see, and that's why we do what we do. Not just our team with the Detroit QRT team, but the people that work for our organization. We work diligently to make sure we meet people where they're at so we can give them and provide them the services that they need. Detroit QRT team, we will be responding to people who are suffering from an overdose within 1 to 3 hours if they do not go to the hospital. If they go to the hospital, we will follow up within 2 to 3 days, and we work diligently, my team and I will work diligently to find these people and meet them right where they're at and try to assist and help them and make their life as safe as possible until the opportunity comes to where they're ready to make the change, because change is difficult. It's difficult for people who are suffering from this kind of disease because Ms. Davis said it, it's a brain disease. Our thinking is distorted. I'm just super, super grateful that I have the opportunity. And I said I wasn't going to cry because I've been crying since I came here this morning, because if you knew my life, it's not what you see right now. It's not what it's always been. And I remember we were just out, our team was just out on John R. 6 Mile, and I was telling some of the people on our team, I used to sleep right there behind that gas station where that tree is. And today I'm able to do what God had brought me out of that to do, and that's to help people that suffer like I did. I don't believe there's no other reason why I'm here besides that the wife and the dogs and all that great stuff is bonuses. But the only reason I was spared from addiction was so God can use me to help other people like me. So I appreciate the Detroit, once again, for giving us this opportunity. And I thank my team, and I thank Dunya and the judge for giving me the opportunity to do this. I'm a person, man, listen, for to be a project manager or something, you couldn't have told me that 20 years ago that would happen, right? But I'm here today because people like Fan, that's in Fan, helped me and made me believe in myself, and now I'm where I'm at. Thank you, guys. Now I get the opportunity to introduce Miss Tamisha. Tamisha will be a part of our team. When this team was being put together, she was one of the names that I diligently talked about because of her compassion and her willingness to go above and beyond. So come on up, Tamisha.
Okay, first I would like to say thank you for having us, and I just have to say thank God that I am here and we are all here, because if it wasn't for him, I wouldn't be standing here getting a second chance to help people. So that's first and foremost, thanking God. So just a little bit about myself. I'm in long-term recovery, and if you would have said that I would be standing here, I couldn't see this, right? And just like the judge spoke about, sending people in and out of treatment, that does not work. We need additional services to help people. So with that being said, with my my story, I come from humble beginnings. I started out in addiction through to opioids, prescribed medications, leading to heroin, and then not having any hope, right? So just for people out there that's listening, I understand your story, and that I'm no different from you. I went from going through treatment and someone believing in me, and that was the CEO of a treatment facility. He believed in me when I couldn't believe in myself. And from there, I went to school. I have an associate's. I have my CPRM, certified peer recovery mentor, certified peer recovery coach. I'm a precinct delegate. So it just goes to show you that when you have hope and you have the appropriate resources in place, anything is possible. You can dream big. I never thought that I could get out that addiction. I was stuck, wanted to get out, but could not because I didn't have that resource. I didn't have Fan knocking on my door saying, hey, I can meet you right where you at. I can provide you needles. I can provide you harm reduction supplies. And people don't realize the importance of harm reduction. When you meet a person right where they're at, eventually they will tell you, I'm ready to get into treatment. I need help. I can't do this anymore. You have to let that person make the determination. You can't make the determination for that person. So with that being said, I never thought that I would be here. And it's just humbling. As far as I go, and I'm shooting for the stars, I'm looking big. I'm letting anybody know that you can dream big. It doesn't matter about where you come from. It's about where you're going. We're not going to look at the past. We're not going to look at, oh my God, I did this and I did that, because I did a lot in my life that I'm not proud of. But I have a God that forgiven me, and I just have to keep moving forward. And as Thomas said, it's no coincidence that I'm standing here. He saved me for a reason. So with that being said, I'm going to do everything it takes, and my ability is to utilize me and be that willing vessel to reach people. And I'm going to leave you with this, is that a person don't really remember what you do for them. It's how you made them feel. Please remember that. It's all about how you make that person feel. And just like the Commissioner Sims stated that he had a brother who was in his addiction. I know that there's someone out here, everyone who knows someone who has been touched by addiction. So just don't forget, when you see that person out there, don't judge them, because someone gave me a second chance. Everyone deserves a second, third, fourth, fifth chance, because I had many of them and someone gave me a chance. So with that being said, I just want to thank the team. I want to thank the firefighters, the mayor. Would love to thank the mayor, and just a message of hope. Again, we're here to be a deliverer of hope, and that's what we're going to do. Thank you. And then let me turn it back over to Commissioner Sims.
Okay, so at this time, we'll open it up for any questions that the media or anyone may have. You want to answer? Thank you so much.
Okay, we have a long history of doing QRT across the state. We have 23 QRT teams. And believe it or not, people want help. So when you go to their door, if their family is there, we get the family help, and then they deliver the message for us. But our team will be diligent, finding out where does that person hang out? Where are they using at? We will go out and look for you. But we have a long history of doing this, and we've always had people that start QRT that are very skeptical about, will people open their door? Will they be receptive to this? They are, because people don't want to be sick. They just don't know how to get out of it. Thank you. Absolutely, and that's why we keep going back repeatedly. We provide a lot of harm reduction supplies and just talks. We used to think that recovery started the day that you quit using drugs. Recovery starts with a conversation. And every conversation that you have with an individual builds that trust and respect. And then when people are ready, they ask you to help them because nobody wants to live this lifestyle.
What does this look like for the first responders? You guys show up on the scene for this stuff daily. Do you feel like this is a huge help that, you know, you're blessed that it's coming now?
Oh, absolutely. I think anytime we can provide an additional service to the citizens or the visitors of Detroit is always a great thing. So our first responders, they will get on the scene. If they have to administer Narcan, they'll do it appropriately. And once the patient is stabilized, then they'll inform them of the services available to them. And they also have to complete their patient care report, which will automatically generate a referral.
Can I say something on that?
Sure. Yeah.
And I think when we look at some other communities that have piloted some of this, what we see is what the first responders really see is they're not seeing the same person over and over, right? It's an opportunity, as Judge Davis was saying, to start a conversation, right? That doesn't solve anything necessarily right then, but it starts getting that connection to services. And what you see over time is fewer times that you've responded to the same individual, fewer people dying of overdose. And we've even seen that from our other harm reduction activities. The more naloxone you get into your community, the lower your overall opioid overdose death rate is, because you're giving people that chance.
How many people are going to staff this initiative, and when's it going to start, and will it be 24/7?
Let's talk about that.
We're going to have 12 people on our team. It's going to be 3 shifts, 8 hours, 24/7, 7 days a week. We're going to have a day shift, afternoon shift, midnight shift. And we're starting Monday on the 16th.
All right.
I see in the release 430 people died of opioid overdoses in Detroit, appreciating it's obviously not just a Detroit problem. I'm curious, twofold question, if somebody can address, are we still on the uptick on this curve? Where are we? Are we making a dent in regard to it? And appreciating it could be anybody, is there a preponderance of people in a younger age demographic, middle age, aiming to try and find out what families maybe can look for, who we're talking about? And I know it's many. I'm not naive to that, but twofold again is, where are we on the proliferation of this, and who are we talking about? What can families look for to intercede?
It's really 3 first.
So we look at this data all the time. As Denise Ferrazzo mentioned, we participate in a large-scale surveillance that's a statewide surveillance. You know, what we're seeing is we're really kind of at a plateau, but when we look deep into that data, what we see is that it crosses any demographic line you can think about. And also in Detroit, we see lots of non-Detroit residents who have overdosed, right? That's something that we look at, right? This isn't a problem that has a wall around it, right? This is a problem that's across, the entire country, but across all of southeastern Michigan. And it includes a large number of young people. It includes people over 50. We've had significant overdoses and overdose deaths in our over 70 group. And we've had many people who've had lifelong substance use disorders successfully get treatment in their 7th decade of life. So the approach to every group is often a little bit different, and that's where our peer recovery coaches are out there and can have some of that shared experience. But it really crosses every demographic line. But we're still seeing a fairly consistent. I mean, we're not seeing the growth in deaths that we were seeing for a number of years, but if you look at that surveillance data across southeastern Michigan, we still have a long way to go.
All right, any other questions? No? Thank you very much. Thank you, Fan, and your team. We look forward to the collaboration.